CODE STEMI is a type of heart attack that usually causes severe chest pain or breathlessness. And we identify that as on an ECG showing ST segment elevation, and that's a medical term. And what it implies is that one of the three major arteries in the heart is completely blocked or threatening to block, and therefore that area of the heart will effectively die if that artery is not reopened. One of the important things to promote in CODE STEMI is that when people are having chest pain, that we encourage people to call 911 and be transported via emergency medical services, and that's the safest way to come to hospital. And the reason being is that if you are in the throes of a heart attack or an ST elevation myocardial infarction, that's what STEMI stands for, the heart can be quite irritable and at times can actually fibrillate, which is effectively a cardiac arrest. And the paramedics have the equipment it takes to resuscitate the heart in a safe fashion. So we always encourage people who are having chest pain to call an ambulance and not to take themselves to the hospital via foot or via car. When EMS has identified a positive CODE STEMI, which once again is suggestive of a blocked artery, they will redirect to our hospital in a quick and safe manner. When they arrive here, provided that the patient is stable, they will come directly to our coronary care unit. If there's some instability, they'll stop in the emergency room to be resuscitated. But provided the patient's stable, they'll come directly to the catheterization lab and to the coronary care unit. We usually have a little pit stop in our coronary care unit. We have a CODE STEMI bay where one of the nurses in the CCU, and actually usually a team of nurses, will meet the paramedics and offload the patient onto a stretcher, and we'll confirm the history and what medications have been given. At that point in time, the team is en route, and that includes someone like myself, who's one of the interventional cardiologists. And my job, along with the three catheterization lab nurses, is to get that patient onto the catheterization lab table so we can prepare to open up the blocked artery. So one of the key things to emphasize is time. And in a STEMI where the artery is blocked, the heart has only so long where it becomes scarred in an irreversible fashion. So we like to get patients as quickly to the hospital as possible, and we like to get the artery opened as quickly as possible. Ideally, we like to get this done within approximately 90 minutes of first medical contact, to the point that we've crossed the blockage with a wire and reestablished blood flow in the catheterization lab. When you've been unloaded to the CCU CODE STEMI bay, we will then move the patient over to the catheterization table, and at that point there'll be a doctor at your side and three nurses. And the purpose here is to gain access to the heart, and we typically will do this by making a very small nick in the wrist or occasionally going from the leg. And we will go up the arteries to the top of the heart where the coronary arteries lie. And there's three arteries that bring oxygen to the heart. And usually we can tell from the ECG which artery it is that is blocked, but we will confirm it by injecting dye and watching the dye run off. And where the dye abruptly stops, that is where the artery is blocked. And it's usually blocked from a combination of clot, or thrombus is the medical term, and atherosclerosis, which is so-called hardening of the arteries. Once we've identified that blockage, we take catheters or plastic tube up to the top of the artery, and then we inject a little fine wire, and we carefully navigate the wire across the blockage. And at that point in time, we reestablish blood flow, typically by taking a very small balloon and inflating the balloon to relieve the artery of its blockage. And then usually we'll finish the procedure by placing a stainless steel scaffold which helps prop open the artery, and we deploy that over a balloon, and that stent stays in place, and hopefully it's opened up the artery, and hopefully has reestablished robust blood flow down the artery, and hopefully at that point in time the patient is feeling better and the ST segments have come down, and the heart muscle hopefully will be on its way to recovery.